Diabetes is a chronic disease that affects millions of people worldwide. It is a condition in which the body is unable to produce or properly use insulin, a hormone that regulates blood sugar levels. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes is usually diagnosed in children and young adults, and it requires lifelong insulin therapy. Type 2 diabetes, on the other hand, is a metabolic disorder that occurs when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin to meet the body's needs. This type of diabetes is more common in adults and is often associated with obesity, physical inactivity, and poor diet. Diabetes can lead to a range of complications, including heart disease, stroke, kidney disease, nerve damage, and blindness. It is important to manage diabetes effectively through lifestyle changes, medication, and regular monitoring of blood sugar levels. Symptoms of diabetes include increased thirst and urination, blurred vision, fatigue, and slow healing of wounds. If you experience any of these symptoms, it is important to see a healthcare provider for diagnosis and treatment. In conclusion, diabetes is a serious and chronic disease that affects millions of people worldwide. It is important to understand the basics of diabetes, including its types, symptoms, and complications, in order to effectively manage the condition and prevent long-term health problems. Diabetes is a chronic condition that affects millions of people worldwide. It is a metabolic disorder characterized by high levels of glucose in the blood due to the body's inability to produce or use insulin effectively. Insulin is a hormone produced by the pancreas that regulates blood sugar levels. When the body cannot produce enough insulin or use it properly, glucose builds up in the bloodstream, leading to various health complications. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disorder that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes is usually diagnosed in children and young adults and requires daily insulin injections to manage blood sugar levels. Type 2 diabetes, on the other hand, is a result of the body's inability to use insulin effectively, also known as insulin resistance. This type of diabetes is often associated with lifestyle factors such as obesity, physical inactivity, and poor diet. Over time, the pancreas may become unable to produce enough insulin to compensate for the body's insulin resistance, leading to high blood sugar levels. Other risk factors for developing type 2 diabetes include genetics, age, and certain medical conditions such as high blood pressure and high cholesterol levels. Women who have had gestational diabetes during pregnancy are also at increased risk of developing type 2 diabetes later in life. Uncontrolled diabetes can lead to serious health complications such as heart disease, stroke, kidney disease, nerve damage, and blindness. Therefore, it is essential to manage blood sugar levels through a combination of medication, lifestyle changes, and regular monitoring. In conclusion, diabetes is a complex condition with various underlying causes, including genetics, lifestyle factors, and medical conditions. Effective management of diabetes requires a personalized approach that addresses these underlying factors and aims to maintain optimal blood sugar levels to prevent complications. Sure. Here's a script about 5 good foods for diabetes. 1. Leafy greens. Leafy greens like spinach, kale, and collard greens are great for people with diabetes because they are low in calories and carbohydrates, but high in fiber, vitamins, and minerals. They also contain antioxidants that can help reduce inflammation and improve blood sugar control. 2. Berries. Berries like blueberries, strawberries, and raspberries are low in calories and carbohydrates, but high in fiber, vitamins, and antioxidants. They also contain compounds called anthocyanins, which have been shown to improve insulin sensitivity and reduce the risk of heart disease. 3. Fatty fish. Fatty fish like salmon, mackerel, and sardines are rich in omega-3 fatty acids, which have been shown to reduce inflammation and improve insulin sensitivity. They also contain protein, which can help keep you feeling full and satisfied. 4. Nuts. Nuts like almonds, walnuts, and pistachios are high in healthy fats, protein, and fiber, but low in carbohydrates. They also contain antioxidants and other nutrients that can help improve blood sugar control and reduce the risk of heart disease. 5. Whole grains. Whole grains like brown rice, quinoa, and whole wheat bread are high in fiber, vitamins, and minerals, but low in calories and carbohydrates. They also have a lower glycemic index than refined grains, which means they are less likely to cause spikes in blood sugar levels. Overall, these 5 foods are great choices for people with diabetes because they are low in calories and carbohydrates, but high in fiber, vitamins, and other nutrients that can help improve blood sugar control and reduce the risk of complications. 1. Sugary drinks. Sugary drinks are high in calories and can cause a rapid spike in blood sugar levels. Drinking water or unsweetened beverages is a better option for people with diabetes. 2. White bread. White bread is made from refined flour, which can cause a rapid increase in blood sugar levels. Choosing whole grain bread or other whole grain options can help regulate blood sugar levels. 3. French fries. French fries are high in unhealthy fats and carbohydrates, which can cause a rapid increase in blood sugar levels. Choosing baked sweet potato fries or roasted vegetables can be a healthier option. 4. Candy. Candy is high in sugar and can cause a rapid increase in blood sugar levels. Choosing fresh fruit or sugar-free options can be a better choice for people with diabetes. 5. Processed snacks. Processed snacks are often high in unhealthy fats and carbohydrates, which can cause a rapid increase in blood sugar levels. Choosing healthy snacks like nuts, seeds, or fresh vegetables can be a better option for people with diabetes. Diabetes is a chronic disease that occurs when the body is unable to produce insulin or use it effectively. It can lead to serious health complications, including heart disease, stroke, kidney failure, and blindness. However, there are several steps you can take to prevent diabetes and maintain good health. 1. Maintain a healthy weight. Being overweight or obese is a major risk factor for diabetes. Losing just 5 to 10% of your body weight can significantly reduce your risk of developing the disease. 2. Exercise regularly. Regular physical activity can help you maintain a healthy weight and improve insulin sensitivity. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, most days of the week. 3. Eat a healthy diet. A healthy diet rich in whole grains, fruits, vegetables, lean protein, and healthy fats can help you maintain a healthy weight and prevent diabetes. Avoid processed foods, sugary drinks, and foods high in saturated and trans fats. 4. Limit alcohol consumption. Drinking too much alcohol can increase your risk of developing diabetes. If you choose to drink, do so in moderation. 5. Quit smoking. Smoking is a major risk factor for diabetes and other chronic diseases. Quitting smoking can significantly reduce your risk of developing the disease. 6. Manage stress. Chronic stress can increase your risk of developing diabetes. Find healthy ways to manage stress, such as exercise, meditation, or spending time with loved ones. 7. Get regular checkups. Regular checkups with your healthcare provider can help you identify and manage any health issues that may increase your risk of developing diabetes. By following these steps, you can significantly reduce your risk of developing diabetes and maintain good health. Diabetes is a chronic condition that affects millions of people worldwide. While there is no cure for diabetes, there are several ways to manage and control the condition. Here are some of the most effective ways to cure diabetes. 1. Medications. There are several medications available that can help control blood sugar levels in people with diabetes. These include insulin, oral medications, and injectable medications. 2. Diet. A healthy diet is essential for managing diabetes. Eating a balanced diet that is low in sugar and carbohydrates can help control blood sugar levels. It is also important to eat regular meals and snacks throughout the day to prevent blood sugar spikes and dips. 3. Exercise. Regular exercise can help improve insulin sensitivity and control blood sugar levels. It is recommended to engage in at least 30 minutes of moderate intensity exercise most days of the week. 4. Weight loss. Losing weight can help improve insulin sensitivity and control blood sugar levels. Even a small amount of weight loss can have a significant impact on blood sugar control. 5. Blood sugar monitoring. Regularly monitoring blood sugar levels can help people with diabetes make informed decisions about their diet, exercise, and medication regimen. 6. Stress management. Stress can cause blood sugar levels to spike, so it is important to find ways to manage stress. This can include relaxation techniques such as deep breathing, meditation, or yoga. 7. Quitting smoking. Smoking can increase the risk of complications associated with diabetes, so quitting smoking is essential for managing the condition. In conclusion, while there is no cure for diabetes, there are several ways to manage and control the condition. By following a healthy diet, engaging in regular exercise, monitoring blood sugar levels, and managing stress, people with diabetes can lead healthy and fulfilling lives. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.